We will do with the presentations and applied physiology of lactations will be done by Dr. Rosina ma'am. And second topic, we will discuss about challenges and solutions for express breastfeeding, storage of breast milk. Then we will go towards breast pump and we will do the demonstrations. Okay, but demonstrations we will do in between the sessions. Moving ahead, I just wanted to introduce our today's sessions, today's resource persons. We have our first resource person, Dr. Rosina Gosumam. Ma'am is working as an associate professor in the Department of Pediatric Neurology Law. Ma'am is also working as an SNSU and UV nodal officers here. Ma'am has done her MBBS from the University of Delhi and MD Pediatric from Himachal University. When we are talking about working experience, ma'am has joined as a junior resident in Maulana Azad Medical College, New Delhi, in the year 2009. After that, she has joined as a senior resident doctor in Safdarjung Hospital, New Delhi, in the year 2014. And since 2014, same years, ma'am has joined in NIGRIMS as a senior resident. Till now, ma'am is working here with us. Currently, ma'am is working as an associate professor. Ma'am has done a presentation as a faculty presented in many national and regional conferences. And due to publication also, both the national and international journals, she has presented many papers. Apart from her daily duties, she is also working under 5 projects. And when we are talking about membership, she is a Indian Academy of Pediatrics, member of this one, and also the member of IIP Palliative Care, Pediatric Critical Care, Neonatology Forum of India, and IIP National Respiratory Chapter. So I would like to thank you, ma'am, for accepting our invitations and willing to present in front of us. We have a second presenter, Sister Nirmala. Ma'am is working as a senior nursing officer, and she is also working as an in charge in OBG ward and nursery here in NIGRIMS Hospital. Ma'am has done a GNM from the KGP School of Nursing, Joy Shillong itself, and have done post basics from the IGNO in the year 2016. And also done a diploma in the nursing administrations from the IGNO in the year 2012. She has more than 22 years of working experience in the clinical area. She is also the member of Trained Nurse Association of India. So thank you, ma'am, for accepting the invitations and willing to do the presentations here with us. So I already told you this year we have a theme for enabling breastfeeding, making a difference for the working parents. So here today in our sessions, we will discuss about the challenges and also the solutions for the express breastfeeding, storage, and breast pump, and we'll also do the demonstrations. But before moving ahead, we just wanted to, refresh your knowledge regarding the benefits of breastfeeding and why breastfeeding is important. Okay, so I'll just give you a brief idea. So as per some research study which has done by Breastfeeding Promotion Network of India in the year of 2019, in the month of July, they have published and they said that exclusive breastfeeding has been done only by 55% of mother in India. And I think now everybody know, as soon as the baby will deliver, we will start initiating a breastfeeding within 1 hour, right? So only 41% of mothers are initiating a breastfeeding within 1 hour. So still the percentage is low. So we are here. I think we hope after this presentation or after this webinar, in next research, I think these presentations will hike up. Okay, so let's talk about the benefits. I think this is a very common topic, and I think most of us here are health worker only. So most of you have idea about what are the different what are the different benefits of breastfeeding. So today we will discuss about the breastfeeding for baby, not only for the baby and mothers, we will also discuss for the family and for the society. Okay, so when we are talking about breastfeeding for baby, can you write down in the chat box what are the advantage of breastfeeding? First we will discuss about baby. So can you write down in the chat box what are the advantage of breastfeeding for the baby? Immunity, thank you. You can write down in the chat box. I'm getting only one. Okay, good nutrition, bonding, thank you. Growth, energy, growth and development, bonding, okay. Immunity, okay. Bond with mothers and child, bonding, thank you. Baby becomes healthy in growth, Okay. Prevent from the infection. I'm seeing lots of bonding. Body growth, okay. Immunity. Maintain temperatures, weight gain, prevent infections free of cost. Okay. Thank you. So let's discuss about the first one. Benefits to the baby. As nutritional properties, this human milk has a nutritional property. Many of you have mentioned in the chat box also. Second is immunological property. They will protect and it also help in development and maturation of infant immune systems. Okay, and even it will help in metabolic clock of the infant, not only metabolic, immunological, or nutritional. It will also help in a psychological advantage. Like most of the participants here writing about the mother-infant bonding. Yes, you are correctly said. Right. And it also help in a neuro development. Okay. Others advantage are it will also helping. This is the first best food for the baby. Okay. And this one is easily digested and it is well absorbed. Okay. By the baby, and it also contains essential amino acid, not only essential amino acid, it also contains polyunsaturated essential fatty acid, which is important for the baby, and also the iron and calcium. Protein and energy, it's usually suited for supporting growth of the infant in a specific area. Okay, so it's there. Reduce mortality and morbidity. Even I have seen in the chat box also somebody has wrote that it will also prevent from the infection. Yes, because if it prevents from the infection, then also the mortality and the morbidity rate will be low. Also, apart from that, it will also prevent from the allergy. It will help for the child better intelligence. And it also, again here I'm talking about emotional bonding, okay? And it also reduces the heart disease, diabetes, and lymphoma. So these are the advantages for the baby. Now we will talk about benefit to mothers. When we are talking about benefit to the mother, here I'm displaying in the screen. I think most of you are already had experience of this advantage, I think, right? Most of you have already a mothers and most of you have already breastfeed your kids and all. So I think you know, first one is it will help in involutions of the uterus. Mainly, it will also help in preventing the PPH and anemia. Okay, it will also delay pregnancy because it will also act as a family planning. We will discuss later also. It will also decrease mother workload. It will save time, energy. Okay, and it also reduce the risk for breast and ovarian cancer. This is very important. Now, I think most of the people are suffering from this ovarian and then breast cancer, right? So it will, if you will feed breast, if you do the proper breastfeeding, it will also reduce from this disease. It also helps regain the figure faster. Okay, and it also reduces central obesity and metabolic syndrome. So these are the advantage for the mothers. Now we will move ahead with the disadvantage for the family and society. When we are talking about advantage to family, it will contribute to child survival. Okay, it will save your time, money. As I already informed you, it will also prevent from family planning, and it also reduce the emotional stress caused by illness. Okay. So, and last one, we will talk about advantage to society. When we are talking for the advantage to society, it lowers the burden of healthcare costs. Okay, because if there is no infection for the baby, and even if the mother is not suffering that much from the complications, then obviously what will happen? Healthcare costs will get reduced. It will also increase the work productivity, environment friendly will be there. There is no waste, no product transportations or packing, nothing. You don't have to do anything. Okay. So in that way also we can save so many things. So this is benefit to the society. So I think this is just this thing kind of refreshing your previous knowledge, because we all are health workers and we already know all these benefits. I just wanted to summarize here before going to the challenges and solutions. Okay. So now I would like to request our first presenter, Dr. Rosina ma'am. So Rosina ma'am will talk about the applied physiology of lactations. I think screen is visible. Okay, so over to you, ma'am.
Thank you so much, Nalika, and thank you all for being here, both in person and online, to attend this CME on breastfeeding and celebrating World Breastfeeding Week. I was given this topic to talk about applied anatomy and physiology. Okay, so anatomy, we all know the anatomy of the breast. Okay, there are three parts basically: the skin, all right, the parenchyma and the stroma. All right, so the parenchyma is where the gland tissue will be present. And in the glands, we see it is made up of this lactiferous sinuses, lactiferous ducts, and these glandular tissues. Okay, so this glandular tissues will be lined by the epithelial cells, which will be important for the secretion of milk. And then the outer lining of the myoepithelial cells, the contraction of which will lead to the milk, which will flow towards the lactiferous ducts and the sinuses. Okay, and then another thing is we have the stroma. So when we talk about the stroma is basically the supporting tissue, supporting fats. All right. So what is the importance of this is this supporting tissue will depend from person to person. So what I was talking about right now, the parenchyma, all these lactiferous sinus and globules and all, they are 15 to 20 in all pregnant, in all women of reproductive age group. All right, these numbers will not change. All right, so what you see in the difference in the size of the breast is basically contributed by these stroma here. Okay, these supporting tissue and fats. So this is the one that gives the size of the breast. Otherwise, the capacity to make milk is the same in all reproductive age women. All right. Sorry. Stop sharing. So, yeah. Okay, then I hope it was clear to everyone. Okay, and then I'm not talking about the whole anatomy. You know that where the extension is, no, from vertical extension and lateral, all that. I'm not talking about that. Okay, so that is basically what I want to everyone to remember at the end of this session, that the size does not matter here. All right, because every woman are born with the same number of lactiferous lobes or lobules, and the size is depending on this supporting fats and tissues. Okay. Then about the lactation. So there are usually 4 stages in lactation. All right. When in non-pregnant women, this process will not start. Once you're 16 weeks onwards, this phase will begin. That is lactogenesis 1. This is when your colostrum will start producing in utero. Okay. So then you have the lactogenesis 2. So this phase will start after the baby is born. That means what happens is when you're still pregnant, there are some prolactin inhibitors, which usually progesterone and others. They will, the prolactin is already high in your blood. But what happens because of these inhibitors, there will be no milk secretion, no milk, copious milk production before the baby is born. So in lactogenesis 2, once the, yeah.
Sorry, I think I'm disturbing you. It's not coming. This is
No, it's not sharing.
It's not coming.
This one. This is local. And now this is fine. Let's go to the next slide and see.
You close this one first. Sorry, okay,
There's some technical issue.
Anything that first.
Okay. Should I move ahead to lactation? I think we can continue. Yes. So I was talking about lactogenesis 2. So this is triggered by the birth of the baby, okay, and the expulsion of the placenta. So this is when your milk production will start producing, visible milk production will start happening. Then lactogenesis 3 is when the milk supply is maintained, usually around day 10 up to 12 weeks of postpartum. That is when your hormone sends a signal to the brain saying that this is the amount of milk that my baby will require. And it will maintain this throughout the first 6 months of your breastfeeding. Okay. Then lactogenesis 4 is when you start weaning, then this will be breast involution, and the process of milk production will markedly reduce. So these are the 4 phases of lactogenesis, which is all regulated by the presence of hormones. Right? So there are different types of breast milk. We usually, I think it's important to understand this because in the first 7 days, we have the production of what is known as colostrum. You all are aware of this, right? But I want to share a little bit more detail about why colostrum is important when you say that the mother's milk is very less. No, but what happens is the volume of colostrum is around 2 to 20 ml per feed. This is actually a lot of quantity. Okay. Why? Because of the energy. The energy of this colostrum is 67 kilocalories per 10 ml. Whereas in a normal milk, it's about 67 kilocalories per 100 ml. And this energy is 10 times more than of your normal milk. It has a lot of proteins, a lot of fats, a lot of lactose. The concentration of vitamin A and vitamin E is 3 times in colostrum than your normal milk. All right. And it has a very high concentration of iron as well, which is easily which is bioavailable, means whatever iron you have, that is all absorbed. Then after the first week, then you have the transition milk, which comes in the next 2 weeks. So this one will have again more fat, whatever fat you have, more fat and sugar content, lesser protein and immunoglobulin G. Then you can get after the third, then from the third week onward, you have the matured milk. The matured milk, there is fore milk and hind milk. What I want you to understand at the end of this session is fore milk is the milk that comes initially, as the name suggests, right? And hind milk is the milk that comes at the end. So fore milk is very watery, it's a little bluish, diluted in color and has a very high content and therefore very low fat, but it still has high protein, lactose and minerals. What this milk does is it quenches the baby's thirst. So if you only give milk in initial maybe 1 or 2 minutes or 5 minutes, the baby will get only this fore milk, okay? And then if you continue breastfeeding for another 10 minutes or beyond that, then this hind milk will get produced, which is thicker and whiter because of the more fat content. Hence, again, it has more energy. And this is the one that quenches the baby's hunger. So if you feed the baby for just 5 minutes, if the baby comes and latches on for just 5 minutes and then the baby releases it, all right, then the baby will, only the baby's thirst will be quenched. This baby will keep on being hungry every 15 minutes, every half an hour, and all that. Okay, so it's important to stress that when the mother is breastfeeding, she should empty her breast and she should feed so that the baby gets the benefit of both the fore milk and the hind milk. All right. Then we also have another special type of milk, which is preterm milk. This is again preterm milk for babies is a species specific. That means you only get it from human preterm milk, and it's baby specific. Okay, depending on the need of the baby, you'll get this milk. Only babies who are born prematurely, their mother will also secrete premature milk. This milk will have more protein, more minerals, more immunoglobulins and lactoferrin as per the baby's requirement. It also has more sodium, chloride, and iron, less lactose and mature milk. So this milk is perfect for the need of the growing baby. That's why we always suggest to give the mother's own milk for every baby. Okay. It's called MOM. No, have you heard of this terminology? MOM, M-O-M, mother's own milk. Okay, that's why we always advise to get mother's own milk for every baby, especially the preterm baby. And then this is a picture that shows the volume of milk that is secreted in terms of weeks. Okay, so in the initial week, it is very less, 2 to 20 ml only per feed. And then with time, the volume of milk keeps on increasing. Okay, so by day 10, which is in the first week only, as you keep on going, like I said, till day 12, that's when your milk secretion gets gets maintained, okay, that your brain gets sends a signal that this is the amount of milk that this baby is requiring for optimal growth. So this milk volume will increase and maintain till 12 weeks, and that will be consistent for the rest of your breastfeeding period. Then what are the factors that helps in breast milk production? Okay, so we know that there are hormones, there are two hormones, right? Prolactin and oxytocin. Okay, prolactin is secreted from the anterior pituitary and the oxytocin is secreted from the posterior pituitary. Okay, so prolactin is the one that helps in the formation of milk from the alveoli, glandular tissue, from the alveoli and the breast tissue. And oxytocin causes the ejection of milk, means the contraction of this myoepithelial cells that was surrounding the alveoli. And then besides this, even the baby is also very important in determining the breastfeeding. Okay, so rooting reflex of the baby, sucking reflex of the baby, and swallowing reflex is also important in maintaining your lactation. Let's talk about prolactin. Prolactin is enhanced by how early the baby is put to the breast. That's why we stress so much on breastfeeding within 1 hour. Okay, because we want this prolactin to be increased, and hence will even our milk supply will also increase as a result of this. And it's also enhanced by how often and how long the baby feeds at the breast. That means if the baby is put every 2 to 3 hourly, right, versus every 4 to 5 hourly, right, then the more often you put the baby to the breast, the more the prolactin secretion will happen. And then how long the baby feeds. Suppose, again, like I said, your brain will get the signals. If you feed the baby for very less time, the brain will think that the baby is full and does not need any more milk. All right, so this will also be affected, and how well the baby is attached to the breast. Then this is hindered by delayed initiation of breastfeeding, and this is especially present in case of if the babies are sick. All right, if the babies are sick or preterm, or if the mother is sick, right, or even in terms of in case of LSCS also. So here, like by the time if there's any complications in pregnancy, or by the time the mother gets weaned out, even here there is delayed initiation of breastfeeding, which we can all correct by early initiation of breastfeeding. All right. Then by giving prelactal feeds. What do you mean by prelactal feeds? Anyone from the audience? Prelactal feeds? Or online, so they can answer. What do you mean by prelactal feeds? Prelactal feeds, any answer, Nanuka? So prelactal feeds are usually feeds that are given before breast milk, okay? So you can sometimes people give water, rice water, honey, all those, no? So those are not advisable. We should not give prelactal feeds at all to any newborn baby. If you make the baby wait for the feeds, okay, suppose the baby is crying, baby is active, and especially right after delivery, if the baby is very active, okay, it's the first hour. So if you make the baby wait longer than that, even that will also hamper your prolactin production. If you're using dummies, pacifiers, and bottles, this will also hamper your prolactin secretions. And certain medications given to the mother and painful breast conditions. These can lead to reduced prolactin production and hence milk secretion. Then this is the prolactin milk secretion reflex. Enhancing factor is an emptying of the breast. So if you empty the breast after every feed, okay, or after the baby feeds, if you express it out or you pump it out, then this will also increase the milk production. By the baby sucking, by the expression of milk, and night feeds. These are very important. Even night feeds, the important night feeds is because prolactin is secreted maximally at night, okay, 2 a.m. onwards. So you have to stress on that. Like you have to tell the parents that they have to give night feeds. All right, they have to express their milk or pump or let the baby breast at night. Then the sensory nipples, the sensory sensation from the baby sucking around the areola and the nipple will send a signal to the hypothalamus, which will cause increase in prolactin secretions and will be hindered by bottle feeding, incorrect positioning, and painful breast condition, like we've already talked about. Then this is a study which was published in January 2023 this year. They did the prolactin level in 3 mothers. Okay, they initially started with the mothers playing with the infants. So if you look at the mothers playing with infant, the prolactin level is not that very high. No, it varies from maybe 10 to around here, maybe around 100 maximum. Okay, so but then what increases the prolactin level is active sucking and nursing of the baby. Okay, active breastfeeding of the baby is what increases this prolactin level, just shot up. All right, so it is important to remember that If you do not feed the baby does not attaches, or you do not pump empty your breast, your prolactin level will not increase. Then let's talk about the oxytocin, milk ejection reflex. All right, so oxytocin, like I said, it will contract the myoepithelial cells. Similarly, if you look at the baby, so this reflex is, this oxytocin is released by, if you think lovingly of the baby, okay, if the baby sucks, if you remember your baby, think of your baby, if you're not stressed, all those will increase the oxytocin reflex, okay? So sometimes if you must have heard of so many parents and all, when they're at work, they have milk let down, right? So this is what is it, okay? Because of oxytocin, that leads to milk let down or milk ejection reflex. So similarly here also, by thinking of the baby or baby breastfeeding and the baby sucking, this stimulation, signal stimulates the hypothalamus, which then sends signals to the pituitary. Then the oxytocin comes in the posterior part. Okay, this oxytocin, again, you know that it works, it acts in the uterus and so helps us in uterine contraction, and also helps in contraction of this myoepithelial cells, which are surrounding the lacteal glands or the endothelial glands, which secrete some milk. Okay, so contraction of this is what will lead to the milk let down reflex and milk ejection reflex. Then this is stimulated by, like I already said, thinking lovingly of the baby, the sound, the sight, even confidence. If you're confident, if you don't have stress, you don't have any worries, you're not in pain or in any doubt, you know that your milk will be sufficient to the baby, that will increase the milk let down and oxytocin reflex. Okay. Then this reflex is also important when we're talking about pumping from your breast milk also. All right, because what happens is when you are pumping from, if you're expressing from one side, there will be let down on the other side as well. Let down will not be just on one side, right? We're doing a let down. This is a neural control, not control in the brain. So when there is a let down, there'll be let down from both the sides. All right. So this is important when you are hand expressing or pumping your milk. Then the reflexes in the baby that is important for increased milk secretion is the rooting reflex. Okay, so if you have a sick baby, a recently sick baby, or preterm baby, they will not be able to root, right? So that will also hamper your milk production. So in rooting reflex, what happens is this rooting reflex in the baby helps with attachment of the baby's mouth to the breast. This is when you touch when you touch the corner of the baby's lips, the baby goes towards your hand, right? So similarly, when you touch the breast of the baby's lips, the baby automatically moves towards the nipple and the areola. Okay, so this the baby's mouth is wide open to take the baby's nipple breast into the mouth. The sucking reflexes, in sucking reflexes, the nipple and part of the areola are rhythmically compressed between the baby's tongue and the hard palate. All right, this wave of contraction will pass on the baby's tongue and from the tip to the base of the baby's tongue, and hence that's how the milk is being, that's how the breast is being milked. And swallowing is the swallowing reflex. Every mouthful that the baby is taking will pass on the esophagus by the wave of peristalsis into the stomach. Okay, so these are the three reflexes that is important for breastfeeding. Then this will do a demonstration of the sign of good attachment. So this is the baby. If you see that the mouth is wide open. Okay, it's not just the nipple that is inside the baby's mouth, includes even the areolas. Okay, so when you're looking at good attachment, the areola and the nipple should be inside the mouth. The baby's mouth should be wide open. The chin should be touching the breast. The lower lip should be everted. All right, and the lower part of the areola should not be visible. Are you doing demonstration, or we'll just continue?
Do the demonstration.
Okay. So we can just demonstrate. Sister Shobha will come and demonstrate the signs of good attachment. So all of you, like when you are assessing any mother who's breastfeeding, please look for these signs. Okay. Sometimes just by doing these, looking at these signs and correcting these signs is enough to stimulate breast milk production and also prevent all those complications of breast milk, no? Like mastitis and cracked nipple and all that. Okay, soreness and also this is important.
Okay. Can you focus? Okay, put the focus that is in that. Focus that you.
Here it is showing. What about the screen? What about your okay.
I think the screen is visible. So Sister Akasi and Sister Soba, and both of them are working as a nursing officer here in India. So both of Then we will do the demonstrations and positioning and latching. Okay.
I have to
I
speak
think
this,
we have to take the table.
uh,
Can you have table to bring here? I think otherwise
or the
mic. Yeah.
sorry.
After the sessions, we will do the discussions at the end, okay? And in the chat box, we have given a one link for upcoming sessions. On 4th and 5th, again, we have another program for the celebration of breastfeeding week only from the College of Nursing. So we will do that one also. It's on 4th and 5th. Okay, so for that registration, I have given in the link in the chat box.
It's a picture of attachment. Not even show it here. If you show here, then they'll not be able to see the screen, no?
Yeah, if I'll show them, it will not even. If I'll show you what will happen, we will not be able to see that.
What's this one? Which one is it?
This one, not this one.
There's another picture.
We have to register.
Yeah. Oh, you did not send by mail, no? It's okay, just talk on this one. First position is favorable position, that is to what the baby is. Or the baby is position. The second one is first favorable position, that is to hold the baby in this position and support your other hand, the left part, and keep the baby in this position. It's called first favorable position. The other one, the third one is hold position. That is while sitting, you can hold the baby in this way. Keep on the arm side, you can keep the pillow and support the baby and keep the baby. So, one more position. And the fourth is leg bend position. That is when you lie down, you hold the baby and lie down and keep the baby. Make sure that it does not cover the most of the baby while feeding the baby. And the last one is side lying position. That is why you lie down with the baby, you support your hand. You support your hand, your hand, and you can fit the baby in this position. This is called side lying position. These are the 5 positions where you can fit the baby according to your comfort.
Next, we will come to one of the itself and the children, the exam. But we already know the position, because when the baby comes in, whether it's whether it's mother comfortable, we will take the baby, whether it's fetal position or the element. Then we will put the baby to the mat, holding fetal position. We'll have this is the breast. Then this is breast. We will bring the baby near the mother breast. Then the baby will be this one. It wants to be opposite to the baby. This one that wants to be opposite to the mother. Then when the baby is opposite to the mother, next the big one will be side to the mother side, and we will press the leg. Brushing is like you support this nipple with this nipple, then we will like hold the baby and brush like keep a big stability. Like this one will be done with the baby legs. They automatically the mother have the baby open the mouth widely. When the baby open mouth widely, we will press the nipples towards the baby mouth. The colon should be forward to the mouth. Then of baby hold the nipples. The nipples press enough press to draw back to the soft palate of the baby on the mouth. Then the baby will suck according to the baby position hungry until the baby is full stomach. Then it will this one prevent from any potential of any.
I think for those who are on site, you can always come and do a hands-on demonstration if you want. Okay, we'll keep this here. You can come and do that. Then we can share the position of breastfeeding. No?
Position that previous one.
Next slide.
I'll show the positions of breastfeeding. I think this is the one. Sister was talking about this position. I think most of you are know about it. Okay. So discussions we will do after the sessions, after all the sessions at the end. Okay. So thank you, Rosina ma'am, for the presentations, and thank you, Sister Akasi and Sister Soha for the demonstrations. So we will go ahead with another presentation. So for that, I would like to request Sister Nirmala. Sister Nirmala will do the presentation on challenges and solutions for express breastfeeding and then storage. Okay, over to you, sis. I think our screen is visible. Screen is visible. You can write down in the chat box. Okay, thank you. Over to you, sis.
Good afternoon, everyone. I welcome you once again. We are celebrating the World Breastfeeding Week, enabling the breastfeeding week from 1st August to 7th August. So the theme of this breastfeeding week of this year is enabling breastfeeding, making a difference for working parents. So my topic will be focusing only with the well baby, those mothers who are going back to work, and those mothers who want her me time. So let us discuss through discussion. Then we will have a question answer session also after the end of the this one presentation. So I hope everybody will encourage all the lactating mother who are going back to the work like we who are leaving our baby at home. Instead of starting the top feeding by buying milk and all, we can encourage the mother by expressing breast milk, expressing storing how to store and keep the baby to prevent any other extra infection and all. So let us all encourage all the working mother through my presentation. Okay, thank you. And thank you all for joining on site as well as online. So the content of my today's presentation, first of all, is introduction, expression of breast milk by hand, expression by pump. Ma'am Rosina will do the needful, but I'll just show the introduction part, how to store, and the conclusion. Okay, so now we have already known breastfeeding is a beautiful natural part of a mother which can give to her newborn baby. So it is a very beautiful thing. Whenever we talk about breastfeeding, we were talking about direct breastfeeding every time. Okay, so we can go through this. Sometimes breastfeeding may look like this also, like it is a mother with the electrical breast pump. It is natural, it is normal now. Thinking of the mother going back to her workplace, mother going out for some of her me time. So this is also a normal one. It's normal. So why? Those people who are joining online, you can put up in the chat box why we need express breast milk. Please share your thought. Then we can discuss it later on. So in this why, what are the indications of express breast milk? The mother is going back to the work or going out for a brief period of time. Like a mother is confined at home, giving direct breastfeeding to the mother, but with the help of express breast milk, she can enjoy her me time. Like she can walk, she can go for shopping, so that she can reduce her anxiety. Due to direct breastfeeding and all. So express breast milk will have the mother to with her going back to the work and all. So next is baby need extra milk or top up feed following breastfeeding. When the mother is not around after giving her breastfeed, so baby may need top feeding. So for that, we can express breast milk and we can feed the baby. Then for sick mother who are admitted in the ICUs, but breast milk is coming due to the physiology. So we can do express breast milk and if the baby is admitted in neonatal ICU, we need express breast milk to feed the baby. Then when the mother has breast engorgement, this is the immediate care of the breast. Express breast milk will help the mother to reduce the pain, to reduce immediate pain and all will be reduced by express breast milk. So expression breast milk can be expressed by hand or with a manual or electric pump. So we can simply put as a definition like expression is a way of taking breast milk from the breast without the need of baby to suck. Earlier we have already seen that the physiology and all, how the baby suck and how the milk is ejected and all. But here we will discuss about how the milk will be expressed out without the need of baby to suck. So now, as per our this year, breast milk topic, working women can successfully give breastfeeding by express breast milk. So advantages of express breast milk, we can see here as breast milk is a natural food. We have already known that what are the good things of breast milk. These are the natural food for infant, and express breast milk also offer the same benefit to the baby. So when the mother wean off the baby from direct breastfeeding, with the express breast milk, she can continue to give the natural food nutrients to the baby. So, and it is convenience also, and it is affordability also, like cost benefit also. So, and can control the timing of feeding. Like we can maintain the timing of 2-hourly feeding. Like for direct breastfeeding also, we usually explain to the mother that every 2-hourly we can feed the baby. Even here also, we can control the timing of feeding. Then can share feeding responsibilities. Not only the mother in direct breastfeeding, only the mother is taking the responsibility of feeding the baby. But in express breastfeeding, we can share the responsibility with the father as well with the caregiver in the family, like grandmother, grandfather, uncle, and auntie, etc. So in EBM allows mother to have a break, leaving enough milk behind for her baby. Like a mother usually confined at home and also she may develop anxiety, she may want to meet her friend or she may want to have her me time. At this time, mother can leave her express breast milk, leaving enough milk behind for her baby to be fed. Then, can donate the express breast milk to supplement for other babies who are in need. Actually, in Meghalaya, we don't have human milk bank. But in India, almost 90 human milk bank have been established. It was first started in Mumbai in 1989. So we will not go inside more about the donation of breast milk. So what are the requirements? What are the requirements as a mother, as a layman mother? What are the requirements for the express breast milk? We should have a proper knowledge how to express, then how to store everything. Proper knowledge is required for express breast milk. Then a clean hand and a clean environment. Then clean storage container or and equipments, refrigerator like insulated bag with ice pack, etc. So like issues in express milk, it is not just issue, it is like the mother used to ask to the healthcare worker, what are the things I have to do during expression of breast milk? So we can discuss it in the coming slide. Lack of knowledge to perform express breast milk. Like everybody doesn't know how to express breast milk. So we as a healthcare worker, we can help the mother how to express breast milk, how to store it. So we will discuss it in the coming slide, like improper collection and storage may lead to risks of bacterial growth and all. If there is bacterial growth, we, instead of doing good to the baby, we may harm to the baby. So let's discuss it and we can help the mother. So what the different type of expression of breast milk? First, we can do always with our hand. Then it is the most cost-effective way of expressing breast milk. And this one, we can always encourage the mother with express by hand. Then manual or handheld breast pump. Then the electric breast pump. So before expression, what we have to do the preparation, like ensure a clean environment, then wash your hands, then apply a warm massage to the breast. I'll come for massage, a warm massaging also. Then remove milk during the time the baby would normally breastfeed. Like suppose we used to advise after every 2 hours when the for the direct breastfeed also. So we will ask the mother to remove the milk during those times. So for warming of breast, how we can warm the breast, like put a warm cloth on the breast. This one we are practicing in our department also, like we used to usually explain the mother to take a cotton cloth, soak in a warm water and cover the breast with the warm cloth. So it will warm up, not with the hot water, it may burn the mother's breast and all. So we explain to the mother to take a warm water, soak warm water, take the cotton cloth, warm it, and cover the breast. Then it will naturally warm up the breast. Or else we can use a warm heating pad. This one we can explain to the mother, like no need to buy anything, heating pad and all at home. If they have electrical water bag and all, just make it warm little and just make she can utilize that one. But we should not ask them to buy or to to go and search about this warm heating pad and all. We can just utilize which is present at home. Then warm water bag. In our household, this one in Meghalaya, we usually have all water bag. So we instead of buying or something like that, they can utilize whatever is present at home. Then like traditional heating pad, like take a small cotton cloth, pad the rice inside, and you can just warm it in a microwave or just warm it in the gas and all. Just make it warm, and you can use as a heating pad also. Okay, so now let's go how to massage. Okay, after warming up, now we'll go for massaging. Instead of going direct for expression, we have to do these two procedure before starting the express breast milk. So let's do how we can massage. Gently massage your breast by using two finger tip, lightly massage from this is the breast from the back side of the breast, that is from the chest side towards the areola, like massaging with these two fingers towards the areola from not only from one direction, you can do from all the direction, from every direction with the two finger tip lightly massage towards. You can do this all direction for 5 minutes. Then and also we can do the massaging by pressly. You can use your 5 tip of the finger. Press firmly on the breast and doing circular massages from all the directions. Circular massages and bring towards the nipple, like from the back of the breast towards the areola and towards the nipple. So this is the gentle massage we can give to the breast before starting the express breast milk. Oh. So I can just demonstrate here this one. This is the base of the breast, like from the back of the breast. Do the 2-finger massage, like lightly massage it towards the nipple. Not only from one direction, you have to do from all the direction. See, all the direction you pull up, gently massage and towards the areola and towards the nipple. From it will like you can do this massage for 5 minutes. And also you can not only with the 2-finger tip massage, you firmly can do press massage firmly with the tips of your finger, circular circular motion, and bring towards the nipple. I think everybody will see it. This one, as a healthcare worker, we can help the mother also, or else we can explain to the mother also. She can do by herself also. Okay. So this is the side view of the hand expression. like how you have to put your thumb, how you have to finger. Like this picture is if the mother is expressing by herself. Okay, you can we can ask the mother to put her thumb just in top of her the areola, and the remaining finger just beneath the areola. This is the mother if she is doing the express breastfeed. This one self-express breast milk. Okay, this is the side part. You can see from this one also. The thumb just above the areola, and the remaining finger just beneath the areola. I think everybody can see it. This one. But if we are helping the mother, the position may change it. Like this is a mother. Our this one finger will be up and the thumb will be down. If we are helping the mother, but if the mother is doing self, then she can hold. The thumb will be just above the areola, and the fingers will be just okay. Okay. Okay, no? Yes. I think everybody can see it. So the position of the hand you can see, and after that you push back the hand and roll forward towards the nipple when you express the breast milk. This is the process. After holding the thumb and the finger, push back, then roll forward towards the nipple, and the milk will be ejected. Okay, so I'll show you again in the front position. Okay, this is from the front position. You can see if the mother is expressing by herself. It should not be only in the one side. Okay, it should be from different side. You can press it. You can express the milk. Okay. Like we have to inform the mother that not only from one direction, it should be multi-directional. So from the front, you can see cup your breast. Okay. Cup your breast just behind the areola. Same thing I have already explained. Then roll it towards the areola and towards the nipple, and gently squeeze using your thumb and the rest of your finger in a C shape. Okay, even in the direct breastfeeding also, for holding the breast, we used to hold in C shape. Even here in expression of breast milk, you can hold the breast while expression in a C shape. Okay. Yes. Okay. So here I will show you like what are how we can make out as the correct expression, correct holding, and incorrect holding. So here I have already told you the thumb will be just up to the areola, and the finger is just beneath the areola. Your thumb should be right on top of the areola, with your first two finger placing pressure right underneath the nipple. This is the correct holding. Then incorrect holding, if you if your hand are positioned so that they are holding too much of breast tissue, instead of holding near the areola, if you are holding too much of the breast tissue, the hand expression will not be a successful one. So this is the incorrect holding. Okay, you should not hold too much of breast tissue. Okay, it may create give pain to the breast also. So we should avoid incorrect positioning. So for hand expression, the timing, we'll just discuss how you can do set the timing. So set aside adequate time to express each breast. Okay. So in each breast, we'll need 3 sessions. Each session lasting for 5 minutes. That is, when you do the expression, you do the expression for 5 minutes, one breast, and you shift to the another breast for another 5 minutes. So for each breast, it will be 3 sessions. That means 3 sessions into 15 minutes, it will be 30 minutes in totality. If the mother has she is new to expression, she may consume lots of time. But if the mother has been practicing, and if the mother started developing the skill, even 30 minutes also she may not take the time. Okay, so while expressing breast milk also, we need patience, we need to develop skill and coordination. Okay, so express, like I have already tell earlier also, that express the milk during the same time that your baby would normally breastfeed, like after every 2 hours and all. And when you feel the breast is filled up and you are having discomfort and all, at that point of time, you can start expressing the breast milk. So like even if we pump, even if we use the manual pump or the electric pump, it is a good idea to finish off the expression session by hand to squeeze out the remaining drops of milk, because sometimes by manual expression, it might not express out all. So we can always will be a good idea to finish up with our hand expression. So I will not go through in detail this one. These are the manual breast pump we can use. Manual breast pump, silicone pump. Like in market we can get in such step. And these are the electrical pump, like automated, we can use by battery and by the electrical connection. This breast pump and electrical manual pump, Ma'am Rosina will this one goes in detail. So now let's do summarize what we have studied, like what we have discussed earlier. So what are the ways of express breast milk, the type, how it works, and what's involved. First is hand expression, how it works. Like we have already told, warm, massage, and compress. So massage and compress breast to remove milk. And what involved is the practice, the patient, the practice, the skill, and the coordination. Then the second type is manual pump. Even this one also handheld. We can use the hand and the wrist to operate a handheld device to pump the milk. Even here also it involves practice, skill, and coordination. So in electric breast pump, it runs by battery or by plug into an electric outlet. Can pump one breast at a time or both breasts at the same time. Double pumping may collect more milk in less time, then need places to clean and store the equipment between uses. So now the expression part has been finished. Now my second part of the presentation is about storage. Even though we have expressed the breast milk, if the mother doesn't know how to store it, it is of this one, no use. So we have to explain to the mother how she has to do the storage. So I think how to store milk, even online, this one participant, you can put up in the chat box how you can store the milk if you have any idea. And we can discuss it in the end of the session. So in scenario 1, mother pumping at work. Mother has already joined. Okay, even friends who are here, you can even we can discuss it, like why to store milk. You please, whoever can discuss with us.
Even the online participant, you can write down in the chat box. Okay, we can store in the fridge for 24 hours, in fridge or freezer. Okay. Why we are storing? Sister was asking these questions. Why we are storing?
Why we are storing?
Even the on-site participant also, why we are storing? You can ask, or you can keep in the fridge and can store up to 6 hours in container refrigerators.
Why?
No, we are asking why.
Why? Not like the storage. Why we need to store milk? Why we need? We have already discussed in the express breast milk. Why we need express breast milk? Then why we need storage? Also, it will come the same. So why we need storage of breast milk?
Also prevent from bacterial infections. Thank you, sis. For working mother, it might be needed at any time.
Yes, that is nice.
To feed the baby when mother is not at home.
Yes,
Thank you. Any others? Even the on-site participant, you can say few these things, few points to feed the baby later, infections.
Yes.
Okay, because require many children.
Yeah, so we can feed the baby when the mother is away. Yeah, we have already discussed earlier this one.
To provide breast milk to the child in the absence of
Of the
mother.
mother,
Okay,
okay.
okay. I think to maintain the temperatures. Very good. Thank you. Thank you for active participation.
So let's go forward to the slide. Okay. So the first scenario here we are putting up is mother pumping at work. Like she has like we have already discussed also, like express the breast milk when you usually feed the baby. So when the mother is working mother for a period from 9 a.m. to 5 p.m., she has to express the breast milk. So for how to store, we will come later on. But the scenario, why to store milk? Scenario 1 is mother pumping at work. So we'll put out the second scenario here, mother pumping before leaving for work. How to store, we will come later on. This is the second scenario. Before leaving for the work, mother has to keep her breast milk for the baby to feed. Then other scenario we can put as sick mother and sick baby, when the mother is in ICU or the baby is in neonatal ICU and all. So after expression, what we have to do is label the container, the date and time on the storage container. Like at what on which date you have expressed it and at what time you have expressed it. Accordingly, we can store the breast milk. Then gently swirl the container after you express it. Don't shake it like we used to believe that if you shake it more, you might this one hamper the nutrients of the breast milk. So these are the storage bottle we can use as plastic bottle with tight fitting. And in this, you can see here also in this bottle, you have written the date and time. Then clean glass lid with tight lid, we can use it. Or milk storage bag, we can use also. But please avoid using plastic container, this one, bisphenol 7A BPA, which has the recycle symbol of #7. Please avoid plastic container using this symbol. So how we will do the storage? Type of breast milk, freshly expressed breast milk, we can store in our room temperature, that is 25 degrees centigrade or colder up to 4 hours. Then in refrigerator, that is below 4 degrees centigrade, we can store up to 4 days. And in freezer, that is -18 degrees centigrade or colder, within 6 months is the best, up to 12 months is acceptable. So these are the freshly expressed or pump milk. How to store it? In room temperature, we have to store up to 4 hours. In refrigerator, we can store up to 4 days. And in deep freezer, we can store within store and use within 6 months, or we can use till 12 months is acceptable. Okay. So the type of breast milk next is thaw milk or previously frozen. Like thaw milk is the breast milk, which we have kept in the freezer, okay, under -18 degrees centigrade. This one, how can you use it? After thawing, you can use the breast milk within 1 to 2 hours in room temperature. And if you put in after thawing, if you put in refrigerator, you can use for 1 day only, that is for 24 hours, but never ever refreeze the human milk after it has been thawed. So this one leftover, like suppose after the breast milk, you have even a freshly milk or even a thaw milk. After feeding the baby, the leftover, you can just wait for in room temperature for 2 hours after the baby is finished to feeding. Then you can discard it. You never refreeze it again, or you never put back again to the freezer again. So when to put milk in the freezer? When to put the milk in the freezer? When there is lots of extra milk and not required instantly for the mother, for the baby. Sorry, like mother has lots of milk, so you need not to this one feed the baby instantly. So as soon as freshly pump or freshly express the milk, you can put it directly to the freezer. And donating breast milk in breast milk bank. This is not for our, like in our state, we are not having this kind of thing, but for your kind information, I just want to put up this one, donating breast milk in human milk bank. So tips, what are the tips you have to this one follow while refrigerating or while freezing the breast milk? Leave an inch from the milk to the top of the container, because when the milk is this one fridge, it tends to increase the size. So you should always leave an inch from the milk to the top of the container. Then refrigerated or chilled milk right after it is expressed, if you don't need instantly. Store milk in the back of the refrigerator, not in the refrigerator door. Okay. Then place it in a cooler or insulated cooler pack. Okay. Place it in a cooler or insulated cooler pack. Insulated cooler pack is a maternity bag for the mother. Usually she used to carry when she travel along with the baby. It has a waterproof, this one, safe inside, and even you can place the ice pack also. When the mother is going for the work, she can even carry this insulated cooler bag so that she can transfer the breast milk. Do not ever mix freshly expressed breast milk with the milk in the fridge. Okay, so proper this one labeling is required, the date and time, so that we can always divide the freshly expressed breast milk and already stored in the fridge. Oh. So tips for thawing, warming up, we have already discussed earlier also. Use the oldest store milk. Like even in the medicine also, first in, first out. So even here in the breast milk also, we can follow we should follow the first in, first out process. Then a second, breast milk does not necessarily need to be warm. This one, even if we feed the baby the cold milk also, there will be no harm. Then place in the fridge to defrost slowly. Like for thawing the milk, you can put overnight to defrost it. Like before going to sleep, you can put up take out from the freezer and put in the refrigerator. Overnight, it will defrost it naturally. So place the container, or else if you want to make a little warm, you can place in the container a warm water and place the milk container in it. Then holding the container of milk under running water also, you can warm the breast milk. No microwaving, no heating or boiling, because it may spoil the nutritive value of the baby, and as well as it may develop heat spot, and it may burn the baby's mouth also. Without knowing, you can just directly heating and giving to the baby. So before giving any milk, just swirl the milk and taste the temperature in your at your hand first. So so that there should not be any burning or overheating of the breast milk. So these are the demonstration. I think I have already explained you earlier, also demonstrated earlier, but as a summarization, we'll just go first. We will just repeat again. Before doing expression of breast milk, what we have to do is wash your hand with soap and water, then ensure clean environment, then place a clean container below your breast to collect milk, massage the breast gently towards the nipple. I have already shown to you how to massage it and how to warm it. Then on after that, you can place your thumb and index finger opposite to each other, just outside the areola. Areola is in the dark soft circle around the nipple. Okay, so this one I have already explained earlier also how to do it. Like even now also I can just show it for this one. This is the thumb placing and this is the finger placing. Okay, then now press back towards the chest. Now press back towards the chest, and you can start squeezing out towards the nipple. So this is the first part is the side view of the expression of breast milk, and the down part is the how you have to do its correct holding and incorrect holding. I think everyone this one need demonstration. I think it's okay, no? Okay. So in conclusion, we can put up as express breast milk is a powerful and versatile tool that empowers mother to provide the best nutrition and care for their babies, even when circumstances prevent direct breastfeeding. As a mother, expressing breast milk is a labor of love, providing nourishment and comfort to your little one, and even when you are apart. Embrace the challenges and determination, knowing that every drop of expressed milk is a precious gift that strengthens your bond and enriches your baby's life in ways only a mother's love can do. Thank you.
Thank you, Sister Jimala, for a wonderful session. I think now people have got pretty much bigger idea about the express breast milk. Now we will do our next sessions. As I already told you, we will do the discussions after the presentations, okay? So now for the next presentations, I would like to request Dr. Rosina ma'am. Ma'am will talk about the challenges and solutions related to the breast pump, and she will also talk about the policies and maternal entitlement. Over to you, ma'am. I think the screen is visible. Okay, thank you.
Thank you, Namika. Thank you, Nirmala, for that wonderful presentation and also introduction towards our breast pump. So what I will be talking about is the continuation of what Sister Nirmala had already spoken, and a few reminder of all the policies and programs that is ongoing in our country, so that we can all educate the mothers and maybe ourselves as well at the same time. So what are the challenges of working mothers? Okay, so these are usually the questions we ask any mother. The problem with going to work is challenges of expression of working mothers. Okay, so they have no knowledge about express breast milk, they have inadequate knowledge about storage. This we've already covered in the previous session. They also said that there's no designated space for feeding or expression or pumping at work. Many spaces don't provide a lactation room. The baby sometimes refuses spoon feeding or kotori feeding if introduced very late, especially when the mother goes to work after 6 months. Mothers have also complained of breast engorgement at work. Sometimes they join work too early, they don't have maternity benefits or maternity leave, and sometimes they don't have enough milk to store. And the last is, it's not a common practice of expression of breast milk or pumping your breast milk. So these are the challenges that we are currently having in the working mothers. There may be others as well. You're all welcome to contribute and discuss at the end. We can discuss at the end of the session. So breast pumps, as has already been mentioned, they're usually manual types and electrical or automatic types. Okay, so the manual will show you a display there. I'll also put it up on the screen. And then electrical or automatic or battery operated, we have either single, means on one side like this, or double, which you can operate both the breasts at the same time. So these are the pictures of your manual pump. Okay, you have this you can use for pumping. And this is another one, which is silicone. This is purely made of silicone, where you can also attach and express the breast milk manually. Then these are the electrical breast pumps. You will talk about the parts and all of this in the later session. So if you look at the parts of the breast pump, it looks very intimidating. Okay, especially for those who have never used it. Then I just ask the audience, how many of you have ever operated a breast pump or used a breast pump, maybe from online as well? Can you raise your hand? How many of you have used a breast pump? Anyone? No, right? So even our own staff have never used a breast pump. Anybody online? Has anyone ever used a breast pump? Nanuka, just check. Anyone? Okay, somebody. Yes. Has been someone has used. So for all, I think all of you will agree that there are many parts which can be very intimidating. Okay, if you don't know how to use a pump, there's so many companies, how to use the problems and all that. We will talk about all those challenges and solutions. Okay, so even using a breast pump is not a full, 100% solution to your expression of breast milk. All right, you always have this option. We'll go through that and we'll talk about the advantages of a manual later on as well. So if you look at this is how it is assembled. You have this is the flange connector. I think just take that. Yeah. This is the flange. This is the breast pump part. Okay, this whole area is the breast. This is the whole area of breast pump parts. This is the flange connector. Okay. Here on this you have the silicone attachment, which this is not made of silicone, it's made of plastic. You have a silicone attachment for attaching to the breast. This is the back plate protector, which you will keep here, and then you have this duckbill valve here, and you have a bottle. Okay, and this is the cap and the covering for this bottle when you finish pumping. All right, you don't need this key. This is just which comes the storage bottle and all. Okay, so this is the total parts of your breast pump. I think I show video.
I'll show video. Yeah.
So this is the fully assembled handheld breast pump. Okay. So when you finish assembling it, you can press like this and you can start pumping. All right. And then the procedure for before pumping still applies. Whatever the Assistant Namla has said earlier, that will still apply. You have to wash your hands, clean environment, and all of these has to be sterilized and clean. All right. And the different parts are, you can remove this. So these are the pump. These are the pump parts. All right. So when you you have to know how to attach it. So this is the flange. This is the flange. This is made of plastic. This is made of silicone. You have to attach it. All right. The different companies that have different sizes depending on the size of the breast. So that again, you have to look personally. It's up to you which one you can use. All right. Then the backflow preventer is here. You attach it to this top. And then there's a duckbill valve, which is attached here. Okay. Or some other valves. And then this you attach it to the collection bottle. Now for electrical pumps, we don't have a sample here. For electrical automatic pump, instead of this handheld handle, there will be one connection that will connect to this battery or like electrical or battery operated pump. All right, so you just attach it to this end. You can switch it on and off, and then depending on the you can switch it on or off. Okay, there's an on button and off button. And then you can increase the speed accordingly. All right. So depending on which pump you use, mainly first of all, you have to know the parts, how to assemble it. All right. And then how to use it. Okay. And sometimes it might work for some women, sometimes it might not work for other women. So that again, it has to be individualized as per your whichever is working for you. Okay. So these are the different parts, and then the other equipments that you need. So I've talked about the pump parts. You also need the USB cable or charger for the pump. Okay. And the machine, this is the machine, and bottles and covers. And you also need storage bags. Storage bags, you can either use bottles, you can use these milk storage bags. And in certain cases, you can, if you're using double pumps, you can use a pumping bra as well. So there are a lot of equipments involved in using a breast pump versus comparing to that of a manual hand expression. Then advantages of a breast pump over manual expression is it is less tiring and labor intensive on the hands. Okay, so if you want to save time, because one breast essentially both the expression will take about 30 minutes, right? And besides massaging, the pumping part will take about 15 minutes. So here you can, it causes less tiring on your hand. You can just use a breast pump and your hands will be free. Okay, so that is one major advantages for mother in using a breast pump or electrical breast pump. Electrical breast pump, basically, manual pump, you still need your hand, but less strain on your hands. Then disadvantages is additional expenses, right? There's so many parts and many bottles, machines and all that, so many storage bottles, you have to look, all this, there's additional expenses involved in buying these breast pumps. Then another disadvantage is it needs repetitive washing and sterilization. For those of you who have used breast pump, you would agree that it is not so simple, okay? So every time you use it, you have to disassemble it, you have to wash it and sterilize it, either by using a sterilizer, using a microwave or boiling. Okay, so again, you have to dry out the parts and reassemble it. So it's not very easy, it needs a lot of work. Then another advantages of the breast pump over the manual expression is it is a faster milk collection. As we've already covered in Sister Nirmala's topic as well. It saves time and it's useful if you have twin babies. So when you're feeding one baby, and like I talked about the milk let down, right? So you have twin baby, you're feeding one baby. So you have let down on both the breast milk, right? And the other breast, you can pump from that breast. Okay, so that way you can feed the baby, you can have extra milk to store and feed the other baby. And it's also useful in milk banking. It also helps increase your breast milk supply, especially if you are pumping after the baby finishes breastfeeding. If you feel like your breast milk is not empty, you can use a breast pump or manual pump, and then you can increase your milk supply, boost your milk supply. And this is it's advantageous for those who are regularly pumping. Okay, suppose pumping multiple times a day, many times a day, it is advantageous for them. Then other disadvantages are parts replacement. So parts, we talk about parts replacement like the backflow protector, then the valve, then the pipes, all those will also need to be replaced. You can't just buy them once and use it for the entire time. Okay, nor can you pass it on to other people as well. So the parts need to be replaced at multiple times. You'll also need additional storage and carrier space, okay, additional storage space in your house. And when you're taking it to work or with you, again, additional bag to carry it. The noise of the machine, I think for those who have used it will know that it is noisy, it's not quiet. It requires, you might need to read some tutorials or have somebody teach you about how to use the pumps. There's also always dangers of contamination of these parts if not cleaned or not washed properly. And it may also lead to oversupply and hence breast engorgement. Okay, so these are the few advantages and disadvantages that I could think right off the top of my mind when I was making this presentation. So the pump parts, this is the duckbill valve, like I was showing you. This, if you're pumping more than four or more than 4 times a day. So this is regular pumping, 4 or more than 4 times a day. You have to replace this every month. Okay, but if you're pumping less than 3 times a day, 1 to 3 times a day, every 2 to 3 months, this will be fine. Then the backflow protector, which is usually attached with this one. So the backflow protector, this, if you're pumping regularly 4 or more than 4 times a day, you have to replace it every 3 months. If less than that, you have to replace it every 6 months. So these are the parts that usually requires replacement for effective pumping. Sometimes if you don't replace these parts, what happens is your milk supply will be affected. You'll not be able to pump enough milk. All right. Then other parts like this wire, the battery, charging, all that will be like if it's damaged, if it's torn, obviously you have to replace these parts. Then let's talk about the existing policies and maternal entitlements, some of which we are already aware of. I hope this is clear to everyone, and you can always come back. Those who are on site, just ask for those who are online if they want any repetition on this. Okay, for those on site, is it okay?
Before you want any repetitions of the topic online, you can message me in the chat box. If you want any topic to be repeated,
hours. It's expensive.
Okay.
So like I said, it is
Okay.
about the disadvantages. So it is expensive. Okay, using a breast pump is expensive as well. So what are the existing policies and maternal entitlement? We all know about the Maternity Benefit Act. No, we all get. Most of us who are working in central or state setup, we all are entitled to 6 months maternity leave, right? Or 26 weeks maternity leave. Besides that, there are many other policies and maternal entitlements. So we'll just go through them briefly so that you can all advocate for other working mothers and for other colleagues that you know who are not getting these entitlements. Okay, so in India, like we've already talked about, this is still 2019 from BPNI, there's exclusive breastfeeding up to 6 months is only 55%. Okay, we need to get this higher. And within 1 hour, but it's only up to 41%. And this is as per NFHS 5 data, which is 2019 to 21. There's again, like why am I mentioning this is because who are entitled to these benefits, right? Because there is only 32% of women in this reproductive age group are employed. All right, that means only 32% of women will be entitled to these maternal entitlements. The rest, what about the rest? What about the rest? 70%, right? So let's talk about a few entitlements. If you look at the cost of not breastfeeding, what the WHO had said was cost of not breastfeeding. Okay, so the results of inadequate breastfeeding is a huge cost. All right. If you think like for anybody who has ever experienced with not breastfeeding the baby, they'll know that it is very expensive in terms of the cost of feeding, the cost of that leads to breast cancer, cause of diarrhea in children, pneumonia, cause of obesity. All these included in India, it's about over 875 crores annually. Okay, this is the cost of not exclusively breastfeeding our child. So this is a lot of cause that can be prevented by this and by enabling and encouraging breastfeeding. All right. And in the world, the exclusive breastfeeding rate up to 6 months is only 38% in 2012. The WHO aims to increase this to 50% globally. In India, it is 55%. But for this number to reach 50%, India has to contribute at least reach exclusive breastfeeding by 65 or 66% for the whole world to reach this data, right? 50%. So we have a lot of impact to make if we can encourage breastfeeding, exclusive breastfeeding in all the mothers. Okay, we can increase this number to 50% in another 2 years or 1.5 years. Then these are the NFHS data about the number of children under age 3 years which were breastfed within 1 hour of birth. If you look between, this is Meghalaya. So in the last NFHS data, the number is very high, it's quite high. It's almost 80%, yes, compared to 60% before that. All right. But then this does not mean that we will ensure exclusive breastfeeding. However, the next slide, as you can see that We look at the number of children who are exclusively breastfed under 6 months. Look at Meghalaya. Despite having 80% initiation of breastfeeding within 1 hour, we're not able to maintain breastfeeding for 6 weeks, exclusive breastfeeding for 6 weeks. Okay, so we're being very happy. We at an institution level, we're doing like a good job, I think, of initiating breastfeeding within 1 hour. But at the community level and further on, whenever you meet the mothers who are or breastfeeding mothers, we should encourage them to breastfeed. Okay, and then also again, the problem here again comes with employment. Now, most of the mothers have to go to work. They're not working in a state or central establishment that will give maternity benefits. So most probably that is the reason why we're not able to sustain this exclusive breastfeeding up to 6 months. Then these are the national guidelines and programs that are present right now. So we have the national guidelines on infant and young child feeding in 2006. This provides a guideline. This is it's available online. This PDF copy. Okay, it provides guidance on feeding of children in different age groups, including babies. Okay, so this is one guideline. Then you have the national guidelines for enhancing breastfeeding. This is by the Ministry of Health, Family Welfare, which was released in 2013. Then there's a MA program, which is okay. This is Mother's Absolute Affection Program, established by the ministry in 2016. This is a flagship program which was just released, a few years ago, which aimed at promoting and supporting breastfeeding practices in the hospitals. There are five components of the program. You can all look at it online or from the BPNI site. Then there's another guidelines on lactation management centers, providing guidance on lactation support staff and human milk banks. So there were several guidelines on feeding and expression of breast milk and how to store breast milk and milk banking. Then there is this breastfeeding policy. So as I've talked about this maternal benefit amendment act, this was amended in 2016. Here, this maternity benefit act says that all mothers who are working has to get a paid maternity leave of 26 weeks. Okay, this is applicable to all those who are working in establishments, in mines, plantations, in shops, factories, or in an unorganized sector in which 10 or more persons were employed on any day for the past 12 months. So anybody who's working in this situation are entitled to 26 weeks of paid maternity leave. All right. Then any woman who has worked in an establishment for more than 80 days is entitled to this benefit. And this will include for those both on contractual or on regular basis. And every establishment with 50 or more employees have to provide a crèche facilities within the prescribed distance of that establishment. The penalties of this is imprisonment of 3 months up to 1 year and fine of 2,000 up to 6,000. This is the employer who will get, who will be fined if they don't provide this act. All right. And where to make the complaint. So you know about this act, how to make the complaint. Okay, there is this Ministry of Labour and Employment. You can file this on this website, samadhan.labor.gov.in. And this act also, the employer may also permit the women, if they can, to work from home. Okay. Then the other policies that is protecting breastfeeding is the infant milk substitutes, feeding bottles, and infant food regulations. This act prohibits any advertisement and promotion of any food and feeding bottles for children under 2 years, including sponsorship of health workers or their associations, gifts, etc. Okay, so this act does not allow any promotion of any infant milk substitutes. Then we also have the National Food Security Act 2013. This essentially says that the mother and the baby should get a meal free of charge during pregnancy and 6 months after the child is born. The maternity benefit of not less than 6,000 issued by both central and state government. And in the case of children in the age group of 6 months to 6 years, age-appropriate free meal should be given free of charge. And the enabling measures for all these policies are effective implementation and monitoring of breastfeeding practices, In the MAR program, like I did not look at those, tell you the components, but it ensures that you provide skill training and lactation support to all the doctors and nurses. Everybody with this workshop, hopefully you'll be trained or have some idea of how to support lactation of all women. Ensure that every hospital, maternity hospital measures and monitors its breastfeeding indicators, such as your breastfeeding within the first hour after delivery. Then strengthen breastfeeding education in medical and nursing school curricula, and also should also involve private hospitals in this implementation. Then there's also accreditation of hospitals as breastfeeding friendly as per the WHO 10 steps to successful breastfeeding. Then launching an awareness campaign for the Maternity Benefit Act, keeping your workplaces more breastfeeding friendly by getting paid maternity leave, by having a clean, private, and well-equipped lactation rooms where mother can express milk comfortably, breastfeeding breaks, allowing mothers to maintain their milk supply, and creche for the babies if the mother is working so that they can take a short break, go and feed their babies, and then come back to work. I should also strictly enforce the IMS Act through its awareness and regular monitoring, especially in the health system. Then this is the whole scheme and the what we call policies and program in a snapshot. The Maternity Benefit Act, which was amended 2017, entitlement of up to 26 weeks of paid leave for the first 2 children, okay, and 12 weeks for the other children. And then this is funded by your employer itself. Then Employee State Insurance Act 948 is again up to 26 weeks of paid leave by the employer. That covers again by ESI Act is. This is a woman whose establishment is covered by ESI Act. They get this insurance. National Food Security Act gives all the mothers 6,000 rupees. This is borne by the government. All births except those already covered in this previous sector. Then there's this Pradhan Mantri Matru Vandana Yojana 2017. They give 5,000 in 3 installments. 60% is borne by the central and 40% is borne by the state. All women, but only first child only. Then there's other schemes which are there in other states like in Odisha, Tamil Nadu, and Telangana. Then these are the, I think we cannot end this session without going through the 10 steps of successful breastfeeding as advised, as written by the WHO. Okay, so this is, the first one is have a written breastfeeding policy that is routinely communicated to all health staff. All health staff in a hospital setting, in a healthcare facility should know that breastfeeding is a policy. They should not encourage or should not advise any formula or infant milk substitutes. Train all healthcare workers and staff in skills necessary to implement this policy. Hence, we are having this workshop today. Then inform all pregnant mothers about the benefits and the management of breastfeeding. Help mothers initiate breastfeeding within 1 hour of this. Here it's half an hour, but within 1 hour can take this. Show mothers how to breastfeed and how to maintain lactation, even if they should be separated from their infants. Okay. Give newborn infants no food or drinks other than breast milk unless medically indicated. Then practice rooming in, allow mothers and infant to remain together for 24 hours. Encourage breastfeeding on demand. Give no artificial teats or pacifier or dummies to breastfeed infant. Foster the establishment of breastfeeding support group and refer mothers to them on discharge from the hospital. So we need to have all of these 10 steps in our facility to be certified as a baby friendly hospital, okay, breastfeeding friendly hospital. Okay, so we need to work on these. Hopefully, I don't know in how many years we'll be able to get this, but hopefully educating everybody about this policy and training all our staff in this, we can be certified as a breastfeeding friendly hospital. Then for successful breastfeeding, besides this, we've already talked about, do not give prenatal feeds, do not use bottle feeding, support the mother in breastfeeding the baby, arrange a mother craft classes, which we have not yet managed to do so, treat breastfeeding problems early, and exclusive breastfeeding for 6 months. Thank you.
Thank you, ma'am, for the presentation. Now we will do the discussions. Now you can write down your queries in the chat box, okay?
Or questions from
Questions
from our
us.
audience also. We
Yeah.
can.
You can ask also from the audience. Anyone wants to ask any queries? On site. Anyone have any queries related to both the topics? No queries?
Questions.
No questions? From our audience, anyone wants to ask any questions? From online also, if you want to share an experience, we are happy to hear you. You can raise your hand so that we will unmute you. If you want to share your experience, if you want to add any points which we have missed out. Okay. So Sakasi, you want to ask something?
Yeah.
Okay. This question for Dr. Rosina ma'am or Sister Nirmal. I think I request both the presenter to come forward. Okay, Dr. Rosina ma'am. Dr. Rosina wants to start. Akasi wants to ask some question. Can you pick mic? By the time she's online participant also, you can write down your queries here so that we will read out. Okay. President ma'am, you can
From our hospital? Well, what I'm aware is one is the free diet. All mothers are getting free diet. And they are stay and all is free of charge. So even the delivery charges, there's no delivery charges for this patient. So that is being given free.
Yes, one question asked by
government schemes. Government schemes.
That master was now was there, but it is.
That PMVBJ, huh?
Sir, you want to add?
Yeah, just as KJS, but that's for traveling. No. Yeah. The JSK and JSS5 will cover the diagnosis, the stay, the meal, and travel.
Was there now?
Yeah, yeah.
Out of this one. Now this one money. That's why they are not continuing anymore from our hospital.
Okay, one question is asked by Jyotsna. So, ma'am, she said like at initial periods, it's very hard to pump in early days, like a milk didn't came, or was due to low breast milk productions or any other issues?
No, if you remember the slide, if you go back to the slides that I had in lactation, no? If you go back to the slides that I had on lactation, you can see that in the early days, the milk production will be very less. Okay. The first 7 days anyway, you'll be having only colostrum. And the entire day, you'll probably be producing less than 200 ml or up, like 20 to 2 to 20 ml after every feed. So in an entire day, you'll be producing probably 100 ml or a little slightly over. So I don't think this.
And also during initial period, the requirement is not that
Yeah,
much.
during the initial period, like I said, colostrum, the energy is so high, it's 10 times the amount of your normal milk. So you will, whatever milk you get, that's 10 times that you will normally give the baby, the energy. No?
I think this Jyotsna, you got the answer. So second question is asked by Rebecca, like if some babies have respiratory distress after birth and have to admit in an ICU, so what the mother can do with the colostrum milk if cannot feed the baby?
The same, we can store it. No, we can store it in the fridge. Because we can store this in the fridge if we think that the baby will take it for the next 3 days, or in the freezer.
If they have the milk bank and all, they can keep and they can donate also, no?
The equipment, refrigerator, and all.
If you have a normal refrigerator, so you can keep it in the fridge.
Okay. What are the absolute contraindications of breastfeeding? Anyone wants to ask? From our audience also, if you want to add any points related to these queries, you are welcome.
If anyone want to share the experience on expression or expression, how they express breast milk or that one, no, the one with the low storage, the previous question, like she has very less milk, no? Anyone has any?
In our audience also, I think all of you are, I think once has gone already through this phase. So if you have any experience, if you want to share, like, I think it's really good for others also, just to hear from you. Anyone wants to share your experience? Either from this online participant also, if you want to share, you can write down in the chat box. And even on-site participants, anyone wants to share your experience?
I'd like to share.
Okay, Dr. Anita. Okay. Can you hand over the mic to Dr. Anita?
So, I have 2 children. As far as the younger one is 13 months now. So, both of them, they first identification with themselves. The first day, having one issue, she has to work. she had a jaundice, she lost her weight, tried to get her again. And with this fact, my breast was not enough. The woman he was, it was horrible. And what's and then I can show for patients. Whether it's now, basically, I mean, we don't study. For the second one, I didn't think any there's something, but yes, I have to should not be that's how I was feeling. Yes, yeah, challenges. But nowadays, I think what is most for that right, the sport that we so that is the issue should have girls like a private very issue or they have we're not eating the so we can class
Thank you so much, Dr. Anisa, for that experience. I think we can take home message to everyone to keep on, expressing and keep on continuing to feed your baby, and eventually you will have enough supply for your baby. Then also one more thing is when you are breastfeeding initially, there's something like you can also start expressing by the time the baby crosses 37 weeks. That means you know that the baby is term baby. You can start expressing your colostrum since that time, because if you remember the part of lactogenesis, colostrum will start coming out from 16 weeks onward. If you think that you know that you have to go to work and you know that you need to express your breast milk and feed the baby, you can start expressing from 37 weeks onwards. Expressing before that will lead to your risk of premature delivery. So we don't advise express colostrum before that. You can express before that, and you can keep them in these almost like a serum vial, which is called a colostrum bottle or container. Like how the serum vial is very less, because you only how much you cannot collect that much colostrum, right? So you can store that in the freezer. Then you can use it. Suppose if initially if your baby is sick, the question the baby is sick, and you have to express milk and give the baby or something, then you can use your own colostrum and your own milk to express and feed the baby. Then
okay. So another question is
Sister Nirmala, anything you want to add?
Okay, so another question is like, again, we will go to Annie. She asks for what are the absolute contraindications for breastfeeding?
There are only two that I know of. One is if the child has galactosemia. So this is an inborn error of metabolism that which is quite rare. So if your child is diagnosed with galactosemia, in that case, you cannot give breast milk to the baby. And the second one is if the mother is undergoing chemotherapy. case if they're taking any chemotherapy drugs, in that case you can give. The rest of the contraindications are all relative contraindications.
Okay. Thank you, ma'am. I think I knew you got the answer. So another question is asked, like, are these policies applicable for the ad hoc or contractual staff as well?
Yes, yes. If you go back to that slide, no, can you just share the screen of the previous slide or the previous presentation? In that Maternity Benefit Act, it says that if you have worked there for at least, if you have worked there for at least 12 months for contractual or 80 days, right? No, no, that last, towards the end, this one. Yeah. This. Step back. No, you're going back. If you look at this, no, Maternity Benefit Act, this is, as it says, let me bring it up. In this, no, so even if you have, if in any sector, whether it's a central or state, unorganized sector, at least 10 or more people are employed, no? You are supposed to get paid maternity leave. All right. But how much is this practice? We don't know. How much, who is,
Have to
whether
register themselves to the ESI.
maybe, yeah.
And I have also seen, like, in some of it, I think it also depends upon your state as well. Because I've seen in some of the state, even the adult and contractual stuff, they are getting the full like benefit, like 6-month maternity leave and all. But again, I've seen in some other state also who are not getting any maternity leave. So they have to leave, they have to sit back at home and they will not get any payment. I've seen that one also. So I think it depends upon state policy.
But ever since this act was amended, 2017, all private sectors and public sectors are providing maternity benefit, paid maternity leave. But how much are they paying and all that
They
don't
don't
know.
have full pay, but they have to register themselves to the ESI scheme.
Okay.
So that they can get the full, they will get the full maternity leave with payment. It is practicing in every state.
And for that contractual ad hoc, no, you have to be working for at least 80 days to be eligible. No?
Yes, yes.
To be eligible for the paid maternity leave.
Okay. Yeah, I've seen some queries related to the storage. I think I am not able to find the questions. One question I've seen, like, if it's in a village, if there is no freeze, how to store? Sister Nirmala, you want to add?
We can always take the help of the ASA worker who are attached with the CAC or PAC. Then in this setup, PAC, they always have a refrigerator. So like the healthcare worker can help the villagers who are in need of storage of milk, how to store, like they can even put up in with the proper labeling, date and time, and they can put up in in CAC or PAC. With the help of the ASA worker, now we can do that.
Okay. So I have seen few questions that is related to milk productions. Some questions are saying, like, some mothers cannot produce the breast milk, or even in some mothers, instead of taking so much fluid and all, they are not able to produce enough breast milk. So what could be the solutions? Anyone wants to add?
Like we said before, the breast pump is not the, it's not the only solution or the golden solution to your breastfeeding. Okay, it will only help in managing your milk output. But ultimately, there's so many factors to breastfeeding. It's not just one. Like you have, Dr. Anita said, you need a proper support system. You need a counseling group. You need home visitors, like lactation nurse visiting your house, helping you with counseling and all that. And then you need, there's so many factors involved in breastfeeding. It's not so simple. Like if you have yes, I can answer that.
Just to add what Rosina was saying, there is one effect we have. Speeds, some others it's all of us. And without your actually your you need only pregnancy. If a mother has carried, if I talk about situations where they need a lot of pregnancy or common pregnancy, the mother has carried a pregnancy. So this mother should have to be able to but there are other things like stress, pain, and all those. So we support to the mothers, and there are such that it needs support. I was just in India, but I personally have noticed that we are sort of doing that advocating breastfeeding for 6 years. Probably we have not been so good at developing a support system or even in terms of skills of healthcare workers. We may not be skilled enough to be able to provide support that these others need. So we have started, we are good at advocating, but now we are supporting, and for that we need the skills required to support such others.
I hope that answers your question, because like what we had discussed, like the physiology of lactation, the applied physiology of lactation, like all mothers should physiologically be able to produce milk, because we have those two hormones, oxytocin and prolactin, which are produced in every mother who has been pregnant. Okay, so physiologically, you should be able to produce milk, but there are very many hindrance towards production of milk, and you have to identify what are those. All right, so that could be one of those reasons which we've already mentioned, could be the reason why you're not getting enough milk supply.
Okay, so I think we'll take two
I
more
think we can
queries.
maybe one more. I think we're already 4 o'clock. Okay, one from the audience maybe. Yes.
Simulation. For those laborer, it's working in relation. 100 days no need to work in relation. Is there any possibilities for host mother, breastfeeding mother, to help them breastfeed the child? Is there any possibilities that in those type of laborer?
Not that I'm aware of, but then usually those laborers, if like I'm just talking from personal experience, they're usually local to that area, right? So most probably they'll have their house nearby where the child is there, no? Is that like you're talking about a mother who's been who just delivered a child and she's working on that 100 days for and how can she sustain breastfeeding, right? One way, what we've already discussed, one is she can do expression of breast milk. If she has a knowledge of how to express, up to 4 hours, she can store it in the room temperature. Okay, even if she doesn't have a fridge, she can store it. And whoever's at home can feed the baby with a spoon or with a bowl or katori. Okay, so that is one way. If she knows how to express, if she gets in touch with somebody who can tell her how to express and what expression of breast milk is. And the rest is, I think, that is one way. But other benefits, because you have to work. I'm not sure about other benefits. Any ideas, Sister Nirmala? Do you have any idea? Does anybody in the audience have any idea about that?
Even from these things, online participant
yes.
also, you can write down in the chat box.
I'm just thinking maybe the government of business just maybe the government maybe.
There is one scheme, no, that what is that called? A PMM, Pradhan Mantri, something scheme, no? They give money. They give 6,000 rupees.
Installment wise, they give.
Yeah, installment wise, they give money.
They give installment.
Okay. So there's one scheme that they give money for first child only, not for every child. Okay. We just go to
Just to add that one, I was specific. I don't think I want to answer that. I just want believe that we will successful breastfeeding. Simple example, every mothers who are effective in breastfeeding. 6 months. So as a guidance on the this is one of the factors we sometimes sometimes mother had a complicated pregnancy months before delivery and she falls short of 6 months. So in that situation we saying that one baby is scared of another something like that. That's scary. You need to utilize, for example, in areas others we can be provided the same or not. We can babies with mother, sometimes they go carry babies on their back, sometimes they are very if always not far. So we individualize a situation when we come to us and see that sort of solution. Because it's called baby, any mother will be for some time. And then we go back to working. Nothing else is working. Unless like the analysis is too much that the family is like. So every mother's will be matched.
Thank you, sir. We have done the presentation in this one also. Slide we will share you in the chat box, okay? So that you will have a better idea. I think we will ask 2-3 questions important.
It's done. Any other questions?
Yes, I think there is a 2-3 questions. I know the time is like it's already over, but 2-3 questions which I feel like is very important. Like some mothers have asked, like if the nipple is cracked, inverted, or if the nipple is bleeding or sore, whether they can do the breastfeeding, or if not, what measures can we do? So this was the one question. Ma'am, you want to answer?
I can answer.
Sister Nimala?
Even though there is a retracted nipple or cracked nipple, mother has to continue breastfeeding only. Otherwise, it may lead to engorgement of breast and it may further lead to mastitis and all. So the thing she can do is just need not to apply any medication or anything, just apply her hind milk and she can continue with the breastfeeding only. First, start from the infected side and like suppose in hospital set up for the inverted nipple, we are using the syringing. So if it is in the home, she can contact a healthcare worker or she can even visit the hospital OPD and all, then she can help how to do the syringing process, or else she can use her finger, thumb and the index finger and roll the nipple before. See that a retracted nipple is like this. When we see retracted nipple is like this, so always we can put like the C process, holding style. Press it up towards the at the end of the areola, and she can use her finger, roll it up before feeding the baby. But here also we have to do the warming first. If it is warming, the tissue will be somehow softer and she will be able to roll the nipple out, and she can use her thumb to put in to press inside the nipple towards the baby's mouth. So initially it will be very difficult for her to do it, but by practicing every day, every feed, the nipple will gradually be out. Then, and other than that, if there is cracked nipples, sore nipples, she should not stop feeding. She should continue it. Do not apply any medication or glycerin or honey or anything. Just apply her breast milk after feeding, and airing is a must. Thank you.
I just want to add one more thing. So the issues of cracked nipple or sore nipple, okay? If you understand, if you know that the main reason behind this is improper attachment, okay? So we already showed you all the signs of proper attachment. If you ensure that the baby is attached properly, you will not have these issues. So again, like Sister Nimala said, continue breastfeeding and make sure that you check the attachment properly. All right. Sometimes the baby might feed only from the nipple without the areola. In that case, you lead to sore nipple and cracked nipple and bleeding nipples.
I see one question is related to the chemotherapy. Dr. Vanitha ma'am has already answered. Chemotherapy is a contraindication. And we will take only one last question. Like one question was there whether HIV patients or the hepatitis mother can do the breastfeed or not. So we'll
Yeah,
answer this.
hepatitis B, we can give breastfeeding. There's no contraindication because in those cases, immediately after the baby is born, we give the hepatitis B immunoglobulin. So if there's any hepatitis antigen that has crossed the placenta, which is the baby, we should get the hepatitis immunoglobulin should work. And we also immunize the baby immediately within 24 hours with hepatitis B vaccine. So the chance of the baby getting hepatitis B is very minimal. Okay, so you can safely breastfeed. And then secondly, for HIV positive mother, if she is on chemo, if she's already started antiretroviral therapy, she can breastfeed. Okay, because like I said, the cause of breastfeeding, not breastfeeding is very high. The child might die from diarrhea, might die from pneumonia before she could die of HIV. All right. So if the mother is already taking treatment, then you can advise a mother to take a breastfeed. Even if the mother is not taking treatment, the baby will always be given on a post-exposure prophylaxis, which we give for all babies. So these babies will be under stringent follow-up from any hospital that they in the NACO is or any anti-ART center that we follow up. So in this case, it's not a contraindication to breastfeeding. So when we are counseling the parents who are HIV positive, please because what happens is if you, like I said, the cause is just breastfeeding, not just in terms of illness, but even in terms of infant formulas and all that, that is very, very expensive. Okay, so the chances that the child might die anyway or might come to hospitals in the cause, we have a lot of morbidity. So if the mother can breastfeed, if you can advise, we counsel her to breastfeed, continue breastfeeding, and they are simultaneously taking the medicine, there should be no harm in continuing breastfeeding. I hope that answers the question.
I think yes. Thank you so much. So I think now we will not take any more queries. It's already time. I wanted to inform you one information that on 4th and 5th, again, we are doing a webinar related to breastfeeding with celebrations only. I'll share the link in the WhatsApp. Plus, I'll share you all the PPTs that we have presented today in the WhatsApp group, so you will get it. Okay, we have come to the end of our today's session. So we are to do the this closing ceremony. We wanted to do the facilitations. To felicitate Dr. Rosina ma'am, I just wanted to request Sister Maureen. Sister Maureen is working